People think it's just a matter of taking pills, but it's so much more than that. It's exhausting.
Hi there.
Hi.
How can I help you?
Hi, I'm here to get blood drawn. I hate this waiting. Waiting for the numbers, waiting to have the bloods drawn, waiting to see the HIV doctor. It all takes place over a 2-week period. And it's really, really stressful. I need God's blessing.
Sharon Sultan?
Here I am.
Hi, Sharon.
Ready to go.
Any problems with the HIV medication?
RDZT.
The 3 antiviral meds.
Okay, that's for the HIV,
Right,
the
yeah.
Epivir, Viramune. Okay, and the Xera. Okay.
Let me have you swallow once.
Let me just take a look at your arms for a second. It's not entirely obvious to me yet.
It's really scary because you have no control over it. You try to do all the right things by exercising and eating right and seeing the doctors and praying, but you have no control over it.
104. You are nervous.
Oh my God, you mean my blood? Oh, it's usually 88.
Yep.
Whoa, I can feel my heart. It feels like it's gonna pound right out of my chest.
Okay.
The heart doesn't lie, does it?
No.
Got the 2 inhalers for asthma, the Flovent and the albuterol.
All right. These are old ones from New York, I think.
I'm going to kind of follow your muscle up the bone and let me know when it stops bothering you.
Do you have an arm preference? Which arm we should
I do. I would prefer this arm.
Okay.
And then also the loratadine, which is for allergy symptoms. That's the
Claritin. Okay, good.
From that, a plaster positive of your foot is made. And from that plaster positive, the foot orthotic that we'll be dispensing today is made.
The visual field is stable, and one of the things that I'll be doing today is looking at your optic nerve to see if it shows any signs of further damage.
We're concerned about possibly one of the medicines causing some side effects.
And you said this arm?
Left arm, please. How's the
I'll
optic
look at
nerve?
the optic nerve sketches and photos that I have, and I'll compare, but it looks, to my memory, it looks like it hasn't changed.
1, 2, 3, poke.
The bottoms of my feet were so tender. It felt like somebody had taken a baseball bat and just beat the bottoms of my feet with them.
The ranitidine, and that would be for the heartburn or acid reflux.
Okay, that's the
generic
okay,
for
the
the Zantac,
Zantac.
right,
Got
yeah.
that.
Doing okay?
I'm fine. Fine so far. It was pretty painless.
Good.
You're good.
Your triglycerides run a little bit on the high side, but not enough that I'm really bothered by that. I think we were always concerned about how high the LDL cholesterol was going.
And then the other one is the Zetia, the ezetimibe, which was a new medication for cholesterol.
In your case, as you know, it's a little more confusing because you've actually, in a good way, lost a lot of weight, which is positive, but at the same time, it kind of confuses whether you are also having some problems with the medication.
Specifically, you have no cataract, you have no macular degeneration, you have no torn retina, no signs of HIV manifestations in the eyes.
When I walk extensively, like in New York, that's the first place that goes. The pain starts there, and then it starts up the foot.
Okay.
Then I get this one totally disabled, and then this one, the tendonitis starts.
I think it'd be a catastrophe if you ran into liver toxicity problems because we'd added another liver toxic drug that would require you to stop those.
It sounds clear in my lungs,
Yes.
right?
I think there were 12
2,
meds today.
3,
Because we
4,
didn't do the eye drops. We
5,
didn't do all the eye drops.
6.
We probably can't get rid of the Xalatan.
So you're talking about adding a third?
Yeah.
And those will go to the lab right away, the tubes?
So I'll send them right to the lab, and then
Okay.
the results will be sent to the doctor by computer.
Okay.
You just passed your 3rd anniversary with us.
Congratulations. Thank you.
Well, I just remember having the perspective when you first came to see me upstairs, how far you've come since then. Because at that time, you remember you're so deconditioned, and you really weren't sure what you're going to be able to do. So I think with that perspective, you see you've really worked hard and come a really long way.